We're going to be a small group today. We're expecting just about 10 people that are new to this. And so it's going to allow for an opportunity for folks to really be able to get caught up on what's going on and learning more about the initiative work. So excited to have you here today. Thanks for joining us. I'm going to go ahead and get started just so we can make sure we can stay within time and that we're able to have the conversations that we're looking for. And then we'll just, as people come in, Liz, if you want to just let them in, and we'll keep adding them. So welcome. I'm Jennifer Valenzuela. I'm the Executive Director at Children's Trust. And if you are here today to talk about the Reducing Neglect Initiative, then you are in the right room. If that was not what you were anticipating, then check your calendar. So we're going to spend a little bit of time. We have the next 90 minutes to really help all of you get up to date on what has been done so far in Massachusetts around the initiative to reduce neglect. We want you to be able to ask questions so that when you go into the convening on May 28th, you'll be able to know a little bit more of what has happened so far. So welcome. Before we jump in and we get off mute, what we would love to know is just who is here in the room with us today. And so if you have a cell phone right there, take a picture of that QR code. And if you are on your computer, you just go to menti.com and then enter those 8 digits. And we just want to know who's joining us this afternoon. And Priscilla, if you can, in Menti, just let us know where we are and how we're looking. And once we get folks in there. I'll give you guys a minute to be able to do that.
Hi, I'm sorry, I can't do the QR code because I'm actually a passenger in a car right now, but I'm on my phone. Can I put in the chat where I'm from?
You can, absolutely. We want to know also your field of work. So we have early childhood, education, family support, fatherhood, home visiting, mental health, parent ed, youth serving organizations, or other. And then the other question that we're looking for is just what has been your involvement with this initiative to date?
All right, thank you so much. I'll put that in the chat. Thank you.
You bet. You bet. Yep.
Then we're getting folks. We have a couple of people that identified as being from the field of family supports, and a couple more people in the youth service organization, and a couple of people in others.
Great. Okay. All right. So what we're really wanting to make sure in this initiative is that we're having good representation across the different sectors of mandated reporters and folks that we know are engaging with families and children on a regular basis. And so this is helping us know just who's in the room, where do we need to look and recruit for more mandated reporter groups that maybe are not as represented. And so thanks for doing that for us. Priscilla, if there's any more that comes in, if you just want to throw them in the chat and just like with the final, that would be great. Okay. So we were going to go into small groups, but because we are a small group, we're going to just stay here together as one. And what we would love to hear from all of you is why are you here? Why are you joining this? What brings you to this work today? And so there's a number of us that are from Children's Trust that are part of the backbone team, and I'll go into that a little bit more. And so we're going to skip those folks. And so I'm going to call out folks that I see different names. So I see Madeline, Unag, Tessa. Let me see if I can go more. Why don't we start with that? So Madeline, if you want to get us started, we'll go Madeline, Unag, and Tessa.
Yes. Hi, everyone. It's nice to meet you. My name is Madeline Shiley. I'm a she, her pronouns, and I am from the Harvard Kennedy School Government Performance Lab. I am actually a part of the opt-in team in South Carolina, working really closely with the South Carolina Children's Trust. And I just happened to be having a conversation a few weeks ago with Sarita from the Children's Trust, and we were talking about my work in Opt-in, and she was like, "You should really join our group coming up." And I can't make it to the in-person meeting, but I live in Massachusetts. I am excited to hear what's going on in my home state. Really passionate about this policy goal of reducing child abuse and neglect and reducing interactions with the child welfare system. And happy to share any learnings that we've come across through Opt-in, which is a very similar initiative in South Carolina for folks who don't know.
Love it. Good to have you. Are you saying South or North Carolina?
South.
South. Okay,
Yes.
wonderful.
I live in Jamaica
in South
Plain in
Carolina.
Boston. Yeah.
Okay, good. Love it. All right. Una, did I have you next?
Hello. Hopefully you can see me. I can't really tell, but I'm in the back of the car,
Yeah.
so please excuse me. I'm Una Bro. I am the co-chair of the Family Advisory Committee to DCF. I'm also involved in suicide prevention. I'm a trainer as well as do fundraising for them. Let's see, I do a bunch of stuff. I'm involved in all the things that you mentioned, from fatherhood to education to you name it. I was also a surrogate parent for IEPs, and I also do foster care reviews. And I'm very excited about this whole initiative. I was at the first meeting in December, and my co-chair is also here with me today, and she has joined this group. Thank you. Did I
Good
leave
to
something
have
out?
you.
I'm sorry if I left something
I
out.
think you're
Did
good.
you ask a
No,
question?
you're
Okay.
good.
Thank
Yeah.
you very much. Bye.
Yeah, you bet. Okay, I already forgot who I said was next. Was it Nicole or Rachel?
I'm not sure. So I'm happy to jump
Take it
in.
away.
I'm Nicole McLaughlin. I'm the executive director of an organization called Plummer Youth Promise. And we serve kids experiencing the foster care system, right? Experiencing child welfare. All of our programs, with the exception of one, serve kids in placement. But we all know that kids need to not be in placement. They need to be in families, right? And so Plummer is certainly committed to moving more into the prevention space, but I think it's the systemic approach to it across mental health and child welfare and school systems is so important that if we all just continue to act in our individual silos, we won't actually get the systemic change that we're all looking for, that will keep kids out of the system and in families where they belong. So I came to the first convening at the Sheraton whenever it was, 6 or 9 months ago or something, but I wasn't able to stay until the end and sign up for one of the committees. So I feel like I've been out of the loop since then. So I thought maybe I should check in on this call and
Catch you up.
catch up.
Great. Good to see you again, Nicole. Rachel, do you want to introduce yourself?
Sure. Hi, everyone. I'm Rachel Neely. I'm an attorney at the Mass Law Reform Institute. I'm the family and child well-being attorney, and I am brand new in my role. I just started in March, and heard about this initiative from multiple people, and I'm so glad to get involved. I've gone to, I guess, a couple of the meetings and watched a lot of the webinars, which are great. And this work, seems to be really, consistent with a lot of the work that MLRI has done and wants to be doing in this space. And I had also done a lot of work on mandated reporting in my last role, which was in Wisconsin, as an attorney for the state child welfare agency there. So I'm super excited to get more involved.
Thanks. I love that we have different states coming in because we learn more from everybody else across the country. So please bring all of that knowledge. Tessa.
Hi, I'm sorry. My video and my sound is not working through my computer, so I hope you can hear me.
We hear you.
My name is Tessa Vanell. I am a foster mom who is, we had two little boys for a year, and recently they were taken away from us, and we're, fighting through the system. But doing everything we can to get them back. We were pre-adopted that had a goal to adopt them. So we're just learning more, and I want to share, I want to learn more from this group. I'm gonna put my sound back on here so I can hear you all. But thank you for letting me share, and thank you for the invitation to the group.
You bet. Good to have you, Tessa. Welcome. And I think, Lori, if you are able to speak, I will wait to see if you come off mute. Yeah. Do you want to introduce yourself?
Yes, absolutely. Good afternoon, everybody. My name is Lori Souza. I am the other co-chair from the Family Advisory Committee to DCF. I'm here with Una. I'm also a member of the Parent Leaders of New England, which is now being assisted by the Children's Trust, the National Children's Trust. And didn't make the first meeting, but I've gotten myself quickly up to speed, and I'm sitting on the community meeting, and they're very, very interested in this work. I think that we can do a lot better all around. So I'm just excited to learn and help in whatever way I can. Thank you.
Thanks, Lori. It's good to have you. Okay, I do want you all to learn there's a huge team behind this effort, and Children's Trust acts as the backbone agency in running this whole statewide initiative. And so I would love for you to just get to see and hear the names of folks. And so, Priscilla, I'm going to let you come off mute and introduce yourself and then pass it on.
Absolutely. Oh, there is a little bit of an echo. Oh, okay. I think it's gone. Hi, everyone. Thank you so much for taking time of your very busy schedule, not only to be with us now, but to be with us in like 20 days, because we're very, very excited. My name is Priscilla Pumarada Urrutia. I am the Director of Community Initiative, and I get to, with these colleagues and everyone in the coalition, be part of this amazing effort to do families and children better. I started the organization about 2.5 months ago, and I am just in awe of the power of the cross perspective that this coalition is bringing together. So thank you for being here, and I look forward to seeing all of you in a couple of days. I'm going to pass the baton to Liz.
Hi, everyone. I am Liz Murata. I am the Director of Marketing and Events at the Children's Trust, so serving on the backbone team to help support all the communications that are happening. Melissa.
Hi, everyone. Thanks for being with us. My name is Melissa Umer. I'm a nonprofit consultant. I worked with the Children's Trust team to get this effort up and running before we hired Priscilla to take over a lot of the work I've been doing. So you'll be seeing more of Priscilla and less of me, but happy that you're all joining and giving us more momentum. Thanks for being here.
I'm going to speak for Cassidy because she is off camera and can't speak right now. She's sick, but she wanted to just listen in and be here. So Cassidy is our Children's Trust Director of Policy, and she also is the project manager for our policy working group. And so if you are a part of the policy working group, you would see Cassidy in that space more. Delbar, I'm going to pass it to you, and then I think we will have everybody.
Hi, everyone. My name is Delbar. I am the Child Sexual Abuse Prevention Content Specialist at the Children's Trust, and I also project manage the Community Working Group. It's really nice to see you both, Una and Lori. They're on the Community Working Group, and it's a great time. Thank you.
Thanks, Delbar. All right. So I'm going to pull us back up on the slides. Thanks for taking a few minutes to introduce yourself, and just it's nice to know who's in the room all the time. And so I'm going to do a little bit more time now with content, and then there are a few different times. So essentially, we want you to raise your hand, come off mute, ask questions. This is not formal. We want to make sure that you are, again, that you have all of the background and are able to come in to the May 28th date and have the knowledge that you need to be able to fully participate. So what we're going to do today, we just got through our welcome. I'm going to give you the overview of this initiative, the data that's guiding us as we're doing this work and what really compelled us to want to do something different here in Massachusetts. We'll spend some time looking at what we've done to date and where we're planning on going in the future, and then answer any questions that may be lingering after there. Okay. So the vision for this work for us in Massachusetts is that we are really able to have a Massachusetts where all of our children and all of our families really are able to access and use community-based supports when and where they need them, and so that all of our families can thrive. And we want them to be available in a way that's equitable, culturally responsive, and effective. And so it sounds very simple, but in fact, it actually takes quite a bit to make sure that we have workforce that is approaching our families in a way that is culturally responsive, that our resources are in fact built in a way that is effective, and that when you go to them, you're actually receiving what it is that you are needing as a family. And so that's our vision. How can we get there? It's the big, bold, vision that we all have. Our goal, what this group specifically is really starting to look and think about, is looking at how we can support better the families, mandated reporters, and the community organizations in strengthening and expanding the existing support pathways that are out there. If there are gaps, then what are the new pathways that need to be created? And then how do we make sure that we're building these really clear, accessible systems of support? One of the things that we want to make sure that we're really clear on this is that people understand, yes, Lori, we will be sending the PowerPoint slides after this. We'll have them up on the site, on the website. One of the things we want to make sure that people are really clear about is that what this initiative is about and what this initiative is not about. And so we really want to be thinking about the prevention of unnecessary reports to the Department of Children and Families. So 51As is what we call those reports in Massachusetts. And so what is it that we need to do? How do we need to go really further upstream so that teachers, social workers, doctors, whomever the mandated reporter is not even having to think about reporting a child and family to child welfare, that we are creating the systems in a way so that it's just not having to be a piece of the pie anymore. We want to do that by creating more of those resources, by making sure, like I was saying before, that they are equitable and that they're actually effective and working the way we want them to and the way they should be working. We want to do this because we know when families get involved with the system, there is trauma involved with that, and so we want to reduce that. We want to make sure those root causes of why some of the issues are reported, so poverty, mental health, substance use, all of these things, how do we make a difference around that? And then also our workforce. So I'm a clinical social worker myself. It's a lot of work and it's tiring at times. And so how do we make sure that this work can potentially support our workforce and prevent the burnout and have them staying in this field longer? What we want to be really clear of what this is not. So we are not focusing this effort on the Department of Children and Families, DCF, and the way they do their work. We are very much working in partnership with them, but very clearly feel in this initiative, it is the mandated reporters that are sending families and children to the Department of Children and Families. And so while there are folks that are doing work on how do we look at the work that's happening within DCF, that is not this initiative. It is getting further upstream and really trying to create the system so that families are not even having to go there. This also is about cases that are reported around neglect. So typically that is how poverty, mental health, substance use, they are filed. So when a report is made to the Department of Children and Families, it's for either abuse or neglect. And so what we're really very clear about is this is not about delaying responses for times when children and supports really are needed. This is not about physical abuse. This is not about sexual abuse. This is about the neglect cases that are filed that we believe there's alternatives to reporting. why we believe and know that over-reporting and why there are consequences behind this. And so in Massachusetts, we very much have this this culture of better safe than sorry. And oftentimes the first thing we do is we file. Like that's kind of the first tool that we pull out of our toolkit is like, let's just call DCF and they'll take care of it. I'm worried about somebody, I'm going to file a report, they'll take care of it. The reality is it is oftentimes like very disruptive for a family when something like that happens. Even if the report is screened out, things like if it is a trusted person in their life, if it's a teacher, if it's a social worker that's working with the family, and then they report to child welfare, you're disrupting that trust. And so now that family potentially is less likely to seek help when they need it in the future if they feel that they've been filed on unnecessarily. You are creating this fear, trauma, toxic stress that comes in with families, generational trauma, what happens oftentimes with generation after generation when you have engagement with the system. We know in Massachusetts, I'm going to go through the numbers in a minute, but we have over 90,000 reports a year that are coming in Massachusetts. We're one of the highest reporting states in the country. And so that is a big burden on our system with the number of families and children that we are calling the state's attention to. And also, when reports are made, they stay on the record for if it is screened in positive. And so we want to make sure that we are being really diligent about the times that we are sending families into child welfare, because if you are a caregiver that is named in a report and then later on you go to work in early education or in teaching world, that is flagged and is seen as part of your check in your credentials. So when we say better safe than sorry, there is actually quite a bit to be sorry about when you do file unnecessarily. And so we want to make sure that people are aware of the consequences that happen on the other side for families when reports happen. So the data that we know for us in Massachusetts, or this is nationally, so most mandated reports of suspected child abuse and neglect, they are not substantiated. So when we say substantiated, what that means is that the child welfare office says there is not enough in here that has us believing that the child is in imminent harm, that there is danger, and so we will not be working with this family. We're going to screen it out. And so as you can see here, of the nearly 4 million referrals by child abuse hotlines in 2021, only 15%, a little over 15% were confirmed by that child welfare agency. What we also know is there is a huge amount of bias and racism that comes into play when it comes to mandated reporters reporting on families. If you are a Black family, you have a 53% chance that your child will be subject to an investigation prior to your child turning 18 years old. When we look at that compared to other populations, it's 37% of all children. And so there's a gross misrepresentation of Black and brown families in the child welfare system. And we'll see how that looks for us in Massachusetts in a second. In Massachusetts, what we can see is that 92,000, so almost 93,000 reports for 51As were made in fiscal year 2024. And so of those 92,000, almost 73% were filed for neglect, 22.5% of those were for physical abuse, and almost 11% were for sexual abuse. So what happens if you're not familiar with like the workflow of what happens is, so I still work in a children's emergency department, and I do still have to report and file at times. And so I start when I make my phone call to DCF and I say I need to make a report for 51A, I'm starting right here at that upper box. And then DCF has to make the decision, is this report going to be screened in or is this report going to be screened out? If you are screened in, that means that DCF has enough to believe that there is more to be looked into, and so they're going to continue to keep that case open, and they screen it in. As you can see here, less than half of those initial 51A reports result in something being screened in. And then when you look to the right of there, you see that 51.4% of those reports are screened out immediately. So within 24 to 48 hours, DCF has said, there's not enough here, it doesn't follow within our threshold, we're screening this out. Now, some reports are screened out for reasons in that there's no child's name. The child is over 18 years old. Some they go directly to the district attorney's office because if it is not a caregiver, if there's sexual assault, that goes to the district attorney's office. If it's child-on-child sexual abuse, those go to the district attorney's office. And so there's a number of some cases that get screened out because they have a different flow that happens with it. But as you can see here, 41,230 of them were screened out. They were not referred to the DA, and nothing occurred on the other end of that. So DCF does not contact the families when a report has been made and they were screened out. The mandated reporters, sometimes they receive notification back of the outcome of the report that they made. Sometimes they don't. Because if you're a part of a major system, so if you're part of a big hospital, they have the general address for you as a social worker. And so that response letter from DCF is definitely going to get lost and may not make it to you for you to know like what the result was with the family. And so we say that because where we want you to understand that is that what if we had a society where our mandated reporters, before they were reporting for all of those families, what if we had the resources in hand and the systems in place so that mandated reporters weren't feeling like they were having to send as many people there? Because we still have 41,230 reports where those families did not receive any kind of additional supports or anything that probably those mandated reporters felt like they needed. And so that is the whole purpose of this initiative, is to get further upstream and to really be able to create a way so that we're accessing services for families, we're supporting in a better way and not doing the reporting as the first option. So who's reporting? In Massachusetts, what you see here is the far left side. Those are our top reporters, mandated reporters in Massachusetts. So it's public safety personnel. So that's police, fire, EMTs. And as you can see, the orange color, those are the numbers that are screened in. So our public safety personnel have about a 52% rate of their reports being screened in. And then the blue number above that, 48% of their reports are screened out. So something to keep in mind around public safety personnel is that anytime a emergency is happening somewhere, so if 911 is called, you may have police filing a report, you may have the fire department filing a report, you may have the EMT filing the report, and then when they get to the hospital is also filing the report. So there's potentially, you're getting at least 4 reports for the same incident and child that is happening. And so DCF may say, we're going to screen out 3 of those because it's the same information, and we're just going to screen in 1. And so some of those numbers do come from those duplications, but definitely not all. Our next biggest reporters are our teachers and others who are working within school. And so, they have a 44% rate of their reports being screened in. And so that tells us we have work that we can do with all of these professions of how do we get it so that it's not just really the same as a coin flip, that you actually are referring families to child welfare that are in fact going to be receiving the services and are in fact in need of those services. And so the rest you can see on here: hospital personnel, medical personnel, DCF, parents and family members, neighbors, and then religious personnel. This shows us where the disproportionality is for us in Massachusetts. And so on your left-hand side, you see the blue lines are the percent proportion of our different populations. So our white child population, 59% total of the child population. And for 51A reports, they are approximately 42% of those reports. And then you see where it flips. And so what you see next is that we have 2.5% more of our Black children and 2.4% more of our Latino families are receiving reports on 51As in comparison to the white children. And so we know that there is some bias that is happening here, that there is things that we need to be thinking about and what we need to be doing differently. Are there interpreter services, languages, whatever cultural things that we need to be thinking about as mandated reporters so that that bias is not playing into our decisions to call DCF and make a report. All of these numbers too are found in the DCF annual report. So they have a great dashboard and you can always go in and you just Google DCF Massachusetts dashboard and you'll be able to find all of the annual reports, and they also have quarterly data that goes up on the dashboard. Okay, so this work, this initiative is how do we create alternate pathways? So how do we think about, besides that, picking up the phone, calling DCF as our first pathway, how do we think about alternatives here so that families can get access to the community resources, mandated reporters can know like where can they refer families to and help with their supports. So we know that mandated reporters, we know that they are critical in identifying and responding to signs of stress. They're with children on a regular basis, pediatricians, teachers, clergy, wherever you are, we know that we are seeing our kids on a regular basis. And so when in fact we see that there are signs of depression in the home, the poverty that may be resulting in not having enough within the home of food or utilities, whatever it may be, how do we help support those families so that they can get to the food pantries, they can get to the utility systems or whatever it is, the shelters, that's going to get them the services that's necessary. As I was saying before, for the cases that are screened out, families are often not offered the services or the support. And what we hear over and over again from mandated reporters is, I didn't know they didn't receive anything. I thought when I made a report that that meant they were going to be taken care of. And so that is really difficult, right? That if you don't know where else to go, if you're a teacher, a social worker, and so you think, okay, I'm going to send them to DCF, and then nothing happens, the family's no better off, the child's no better off, the teacher is no better off, and we're right back to square zero. And so how do we create other alternatives? So before we keep going, what I would love to hear is what comes up for you as you are hearing this data? What questions are coming up for you? What are some other things around data that you would want to know?
Jennifer.
Yeah.
I just wanted to say, I need to turn this off. You said families are back to square zero because nothing happens after a 51A is filed, but I would argue that they're not square zero because the 51 is on their record. So they're below square zero.
Yeah, that's right, Tessa. That's right. They're no better off by, they don't have resources. There's nothing now that's there for support. And yes, and now they have DCF that has, even if they're not involved, they are now part of their life in one way or another. That's right. Any other things, any other things that comes up for you as you're looking at this data, hearing it?
You can go for it. I noticed that almost half the reports that were made, whether they were screened in or out, were by public safety personnel or teachers. So that gives maybe this initiative like a pretty targeted way to try and speak to certain mandated reporters who are making most of the reports.
Yeah, that's right. So we definitely will talk about who's on the steering committee, but that's right, Tessa. So we know at folks in the healthcare system, folks in the educational system, public safety. Those are our largest reporters. And so we are doing very concerted efforts in making sure that we have that. And it's so lovely to see Regina here from DESE, because as the education space is where we're really trying to make sure that we have more happening, those are the relationships that we need to build and make sure efforts are happening there. Any other things where you were surprised by, or questioning anything, or wanting to understand more?
I think I would like to see some data on how many children struggle with mental illness, and that it's not neglect or abuse on the side of the parents, but the only place they have to go or are sent to is DCF, sometimes by the hospitals, by the schools. I would love to get some more data on that and see what we can do to have somebody else pick up those families and kids.
Yeah, that's right. So the reality around the number of that, if you think about the workflow, the numbers that we were sharing earlier, that whole bucket of screened out families, the 51.4%, we actually don't know a lot of information about them. And there's not a ton of data that's collected at the very beginning for reports, for the 51A reports. There's basics. Really, when the data collection starts happening is once it's screened in and once DCF starts getting more involved. And so we've been working with DCF. They've been a great partner in this with us. And we are bringing in that data, but we don't necessarily know like the very specific reason is because of mental health that we're able to then say, this is the percentage of those screened out that have to do with mental health.
No, I'm not talking about screening out. I'm talking the ones that are screened in. They're screened in because they need the help, but the only place they can get it is through forced DCF involvement. Those are the ones I'm talking about.
Right. Yeah. And remember, this isn't about that, right? But this isn't about like when we're moving into there, we're thinking about like where are those screened out? Most certainly mental health services are things that continue coming up: parental mental health, child mental health, the work in family resource centers around the educational legal services and supporting around that. 100%. That is in these conversations. And so, yes, how do we get further upstream in that?
That's what I'm trying to say. I hope I was explaining it correctly. That's what I was trying to get at.
Got you. Okay. Got it.
Thank you.
Yeah, you bet. Nicole, let me see if I can read yours out loud. If you don't want to come off, do you want to come off mute and say it, Nicole?
Sure. I was just thinking about, all those families that are screened out and that then aren't referred to any support or aren't provided any support, and whether or not they then later come back in, right? Whether there's another report filed at some point, and and assuming if there is, just what an indicator that is of our failure to support those families.
Right. Yep. Yeah, where you have multiple reports, right? And if that was the only support that was happening for the family and nothing else in between, that's right. And so we do know that happens. We definitely hear from mandated reporters where they say, like, I've filed now 3 or 4 times and we're not getting anywhere. And so one would think like, okay, what are some alternative pathways that we can think about then for these families? Yeah. Okay. All right. Anything else? Otherwise, I will keep going. Okay, let me get these slides back up. So there we go. All right. Okay. So where have we been? Where are we going? What's been happening in the last probably like 8 or 9 months as we've been going? So this is our structure. This is the body of people who are working around this in Massachusetts. on your top left-hand side, what you see is what we started with was our community steering committee. And so that is representation from the different mandated reporter sectors that we were talking about and leaders within those different fields. And so on the community steering committee of education, we have somebody from the Teachers Federation, no, I'm saying it, the American Federation of Teachers. Regina, if I'm getting this wrong, please put it in the chat. AFT, American Federation for Teachers. And so we have somebody from their national office that is on the steering committee, and they at their national office are doing quite a big movement with teachers around this shifting from reporting to supporting. And so we're really pleased and really very lucky to have her on our steering committee, who is helping and guide us and bringing in data that they have both nationally and locally here in Massachusetts that they've learned from teachers across the state for why they're filing, what's behind that, and what would be helpful for them in making adjustments for teachers. We also have the healthcare sector represented, human services, lived experience, and others that are within here, the legal services. And then we also have the state steering committee, where that is representation from many of the state agencies that are working with children and families. So you can see them all here on the top right-hand side. And so what we did last year was we started separately. So the community steering committee got started. We were working on the goals and structure. The state steering committee came in a little bit later. We were having like asynchronous work happening with one another to get started, just to understand within our different perspectives of how this work goes. And then we merged everybody together in, I think it was September of last year. And so now we have one steering committee. And so it was the community steering committee and the state member steering committee. We have since added a lived experience group that is embedded within all of this. And so I'll go into that a little bit more later. And so the steering committee is the leadership body. And then backbone support for that is by Children's Trust. So we provide backbone in that we are the ones doing the communications and the convening. We also provide the project management work within all of the working groups. It's our Zoom accounts, just all of the different things that it takes to keep these types of initiatives going. And then the whole coalition has been broken down into 5 different working groups. And so we have our program working group, the workforce working group, community, and the policies. And so what's happened is when folks came to the broader coalition conversation in December, we then said, which category would you be interested in to work more in? And then those groups, those working groups, are meeting on a monthly basis. The lived experience group is a separate group that comes together for those with lived experience, and they are providing support for one another, and then they are embedded within all of the different working groups at different levels. Some are co-chairs of the working groups, some are within the steering committee, and then some are participants within the working groups. So where have we been going? Like, what is it that we're trying to do? How are we trying to make the change within our systems? What is the work that we want to be different? And so over this past almost year, we really have been thinking about like how we're working together differently. So what we're excited about for this initiative is that we have both state folks and advocacy folks and families with lived experience and our nonprofit leaders all together at the same table. And so we really want this to be representative of all of the different people that are impacted by this system. We are wanting to make sure that we're building out like what's the trust and the relationships that are needed in order for this to happen. Ensuring that we have shared power. We came in and we made adjustments since December around how we had more lived experience at the leadership level. We also want to make sure, are we all coming in with the same baseline knowledge of information? And so what we quickly learned was that some people had the same word, but very different definitions behind those words. And so we're trying to make sure that we are speaking the same language when we're doing this work. And then we also, as a group, we're working on what is our vision, our goal. We built out a theory of change. It took multiple iterations. We got feedback from families with lived experience, from mandated reporters, from steering committee members, and after multiple iterations, built out a great theory of change. And then what we're wanting to make sure is what will look different in here. And so how do we start aligning our work better? How do we make sure that, I was on a call earlier today where someone is stuck between DDS and DMH for their child. And so how could an outcome of this be about how we're making our systems better aligned so that when families are needing access to services and resources, they're not having to get ping-ponged all around to figure it out. We, as the providers of service, are the ones that are doing the aligning, and we're the ones having to deal with it going back and forth instead of making the families do that. What we also want to make sure that we're doing differently, that we're elevating the leadership of our families that are affected by the system, the partnerships, policies. We know that we can say we build all of these programs for mandated reporters to be easier to access services. Massachusetts is quite resource rich. We're not very well coordinated. And so we also have these policies that oftentimes mandated reporters say, I have to report, or my, system makes it so that I have to do X, Y, and Z. And so how do we look at our policies if that is in fact what's needed to be done? So what's been done to date, this is in no order, but since last summer, we built out the steering committee, the working groups, as I just mentioned, and really making sure that that is representative of the different mandated reporter groups and all of the different players that we need in this. We built out the lived experience group. And so in January, we had a group of folks with lived expertise in either growing up in the system as a grandparent, kinship care, as a parent that has had their child, experience with DCF. And so that group built together the recommendations for how lived expertise needed to be a part of this and what that structure should look like. And so one of the recommendations was that there would be 10 seats on the steering committee, but for people with lived experience. And so those 10 seats have been added to the steering committee, and we are doing like a slow integration of folks coming on. So I think we have 4 or 5 right now, and there will be continued addition as we get representation in the different groups of expertise and experience that we want on the steering committee. We've also been taking time to build the relationships, doing something like this so that we can make sure people really understand what they're walking into before they come. We're having lots of one-on-one conversations with partners outside, folks that want to know more, folks that want to get more involved, and just making sure that people are understanding what this is about and what this is not about, as the slides earlier had talked about. We also did a lot of conversations around how is racism impacting our system? How is our bias making a difference for how we have such a disproportionate impact on our Black and Brown families? And so we focused on some of that in our December coalition. We're about to have some more webinars on this with our consultant from Overcoming Racism, who will continue doing more. Matthew will also be back in our retreat later in May. And so we'll continue having that be part, because we have to understand how our history and how racism is playing into this. Otherwise, we'll just keep repeating the things that we're doing currently. We want to learn from others. So love that we have a couple of other states here in this call right now. And so how do we learn what others are doing across the country so we can think about things differently? We also we did some story banking earlier this year. So Kate Warren Barnes is one of the supporters within this work. She's on our steering committee, and she did story banking last year with 11 adults who had either been in the system as a child or as a parent. And we really wanted to hear from them, like, if you could have prevented any engagement with child welfare in the first place, what could that have looked like? And so those stories have really, they were part of the foundation of this as we were building out last year. I've talked about this already. So the lived experience and how we're integrating that more. And so we definitely learned in the December convening that we needed to do more. We had already done a little bit, but there was definitely room to grow. And so these last few months, what we did, our working groups, we decided that no decisions would be made from January through April, and so that we could get the lived experience integrated into the working groups. And so what we did instead with the working groups was we did more data sharing, more shared understanding of the work. And while the lived experience group was developing their recommendations for how they wanted to be integrated into this work. So as I mentioned, we brought in, they recommended that we had 10 additional seats in our steering committee. And so excited that we have that coming in. We also we created a fifth working group. And so we now have the lived experience permanent working group in there. The group is doing recruitment very specifically around the different experiences that bring folks into the child welfare system. We have funding developed for the next 2 years so that we can compensate folks who are not being paid for by an employer to be in this work, to be able to be at this table. And then we're still making sure that we're building out whatever other support structures or anything else that are needed so that we can have good representation across this effort. So a lot of times people say, so are we just talking about stuff? What is this actually going to be? And so we're doing stuff. We will be building alternatives, and what those will be is still to be figured out. So each of the working groups meets on a monthly basis. Right now, where those working groups are is they are currently just really, like I mentioned, getting shared definitions and narrowing in on what are some things that we might want to pilot. And so on the programs working group, they are really thinking about any alternative pathways that would really strengthen and align the community-based supports. How do we get better coordinated alternatives for families? How do we make it so that it's not so difficult to access those resources? And then how do we make sure that those have really good follow through? So the programs working group is co-chaired by our DCF worker, Jasenia, and then also our Families First, Sue Kovitz. And so Jasenia Pilato from DCF, Sue Kovitz from Families First, they are the co-chairs for the programs working group. On our workforce working group, we have Chelsea from ATS, and then we have, I'm blanking, so somebody can put it in the chat for me. I've totally lost. Rochelle from DESE is also our co-chair here. And so we have a great representation around the educational workforce. And so what we're hoping this group will be able to come to is, how do we think about, are there tools out there that our mandated reporters need? Is there training that's needed? Is there like a data share back process that we need to be thinking about? What is it that we need to do for our workforce so that they can be better skilled, better knowledgeable, better prepared with the information they need and the tools that they need so that they can respond with families. We also have a community working group, and so that currently is being co-chaired by the Housing and Livable Communities Assistant Secretary, Chris, and I also am losing his last name right now, and so he is doing it. We are looking for our next co-chair on that because our previous co-chair is now our new Office of Child Advocate, Marisol Garcia, and so she's stepping off of this and is going into her new role in a few weeks. So that community working group is really thinking about, they're talking a lot about housing and how the housing is impacting our families and oftentimes can lead to child welfare engagement. And then our policies working group is co-chaired by, this is our largest co-chair group. And so we have Nancy Scannell from MSPCC, we have Chrissy from Office of Child Advocate, we have Julie from Hopewell, and we have Liza Hirsch from the Attorney General's office. And so that crew is co-leading this working group. And they are really having conversations around at what level do they want to be focusing their stuff on. And so big P, little p, really starting to think about that and what's possible. And embedded within all of this is our lived experience. And so this is how the work is being built out. This just goes a little bit further into what I was just talking about. And so you can look at this when we come back, when we send these slides to you all. So then what's happening going forward? So what is it that we're going to be doing differently, and what are we going to be doing together? So we're meeting May 28th. So that's going to be our next convening. We will come together. We really want to focus our time together in May around building the relationships with one another, collaborating together, learning from one another. And so focus will be within that. We'll have our working groups coming together during lunch to just get to know one another better. We will have a better integration with lived expertise within the agenda creation and the work. And so that will be May 28th. And then from there, we will go back, we will resume to our monthly working group meetings. And this is where the co-chairs are driving the working groups to prioritize and to narrow down into what are some of the alternative pathways that we want to do. There's been brainstorming that's been happening for the last almost year around possibilities that we could do. And so now it's time to start narrowing down. So they're going to narrow down in each of those working groups into what those potential solutions can be. There's going to be some pilot creation, developing, sketching. The steering committee will be overseeing that, hearing about it, learning about it on a regular basis from the different working group leaders. And then in December, we come back together as a full coalition, December 10th, and we will be sharing out what those pilots are looking like. So that's our best laid plan. We thought actually we'd be doing that in May, but we adjusted the schedule because we realized that we needed to make some changes with the lived experience. And so we put that on pause. And so we're now pushing things out a little bit. So as of today, May 11th, this is what we think is what the coming months are going to be like. And stick around. I don't know. Things may change as life comes up and something else might adjust it. As I mentioned before, May 28th, this is what we're really trying to focus on. It's that connection, clarity, and the collective action. So I'm going to stop sharing my screen there. Opportunity, questions. I see there's chat in there, so I'm going to come off sharing so we can work through those. And if you wrote your chat in there, feel free to come off mute and to say it to everybody.
Jennifer, at the
Okay.
May 28th
Yeah.
convening, if we're not already part of a work group, are you going to be, will we be able to get ourselves into one? Is that what you're thinking?
Yeah.
Okay.
Yeah. What do you want? What are you interested in? It's pick your adventure, Nicole. So
I think programs.
Program. Okay, then there's your adventure. So we'll get you, just be on the lookout for the program tables during lunch and go find your way, and there you have it. It's that simple. And we'll make sure you get on that listing too as we move forward.
Awesome. Thank you.
Somebody asked, looks like Madeline asked if the theory of change would be available to the public and the story banking. After the story banking, I believe, Liz, correct me if I'm wrong, but I believe the story banking report is already on the website. It was the report that Kate Warren Barnes wrote. Is that up yet?
No, it's not final yet, but will be up soon in the next few months.
Okay, great. And then the theory of change, yes, we can definitely make that available and have that for more folks. And yeah, I think Melissa put the landing page on there, so you can find all of the materials that we've shared to date are out there. What else?
Jennifer, this is Madeline again. I really appreciated hearing this, and I think there's so many interesting ways that this work is complementary to the opt-in work and also different in some significant ways. I think I probably would have the most to offer on the program side as well. I can't make it to the 28th team, but I'm happy to join virtual meetings as they come up, or in-person meetings, but I just am out of town on the 28th. So
Yeah,
that would be
you got it.
included. Thank you.
Sounds good. I think the program working group is definitely the most subscribed to, because all of us, as we're doing the work, we want to know like what are the things that I want to help my families and get connected to. And so it's great. Good group. Anything else? We want to make sure you're able to be there later this month. And if you're not able to be there this month, that you can still continue on throughout all of the virtual opportunities too. Madeline, do you want to come off mute?
I know at the end of the meeting, but there's so much to talk about and happy to share. We do have one type of alternative pathway going in South Carolina. It's a screen out pathway to some navigation services. It's not quite a warm line, but is done through our DCF equivalent. And definitely some thoughts on what's working well and some thoughts on what's not working so well with that. And how much control this type of work is able to have over is a later subsequent screen in because of the additional forces that exist outside of this work. So really excited to hear that there's such a focus on mandated reporting and community and policy as part of this effort, because I will say I think that's something that we're currently missing. We're focusing so much on the programming and so much on what's being offered to families, which is amazing. But with only that sort of prong, you're not really able to influence how reports are made and what impacts families are having.
Yeah. I'll tell you, just like as for all of you, like kind of as this was being developed over the last couple of years, when we were doing, so this was part of the Children's Trust strategic plan, so which was approved about 2.5 years ago by our board. And so for about a year, we just did a lot of like a listening tour, went around the state to find out who's working on this, where should we be involved, should we even be involved at all, can we support if there's something already happening. And what we really learned was that there was not any concerted collective effort happening. And so Children's Trust took this on, and it works for us because we are both as a state agency and as a nonprofit, we can play in this role of both, and it's really helped to be able to bring all of the different players to the table in a way that I think if you're from the outside, it's really hard to do with state, and if you're from the state, it's really hard to do with folks that maybe you're funding or whatever that may be. And so, so as we were doing that listening tour, depending on who we would talk to, the conversation would go really deep with their specific know-how. And so when we were speaking to the advocacy space or people in the legal components, it was all policy, all legal, all changing of the laws. When we would talk to families, it was often that community bucket around like your support mechanisms and within places in there that nobody's really thinking about from the programmatic world. Workforce, we heard a lot of folks wanted to talk about that, and then the programming. And so it just really felt like if we were to do one over the other, we would be losing out and we would just miss too many people who need to be a part of this. And it's such a comprehensive, it takes so many different aspects of this work to make this change. And so, I know some folks have started at the policy. We had some recommendations of like, don't start at policy because you polarize people too fast. And then you're going to lose potentially all of your folks who you might want at that in this work. And so if you can do, multiple, then trying it. And so we're trying it. It's a lot. It's, so we'll definitely drop some balls here and there because we've decided to make it the more comprehensive approach. But excited in that it brings in folks to no matter where you are in this effort, you can find your spot here. All right. Anything else? Otherwise, you can have almost a half an hour free and enjoy some time. All right. we're looking forward to May 28th. We do know our next time will be December 10th, and we are going to go more in the center of the state so that it's easier for more people. So I think we're in Worcester in December. So look forward to seeing many of you in a couple of weeks. Madeline, we will miss you, but we will see you virtually in more of the program working group work. And enjoy your day. Have a good week.
Thanks very much.
Everyone. Bye.
Bye.
Thank you. Bye.